Okay, this video is an introduction to estrogen and estrogenic chemistry. It's really easy to learn, but you got to have this framework if you're going to understand the rest of the stuff you're going to hear about estrogenic. It's really important to know about estrogenic chemistry because in America, people are exposed to tons and tons of estrogenic chemical, and it's very harmful to your health, and it increases your risk of breast cancer, of obesity, infertility, all kinds of problems, autoimmune diseases, and it's associated with hypothyroidism, menstrual problems, all kinds of stuff, and it's really easy to learn this stuff. Okay, so first of all, Mendeleev, the Russian chemist, had like little baseball cards, all the different chemicals, and he made the periodic table of the elements. Well, I was looking at all these different estrogenic chemicals, and I decided to make them into a periodic table of estrogenics, so to speak. So there's the ones that come from foods and plants, so you avoid those by avoiding these things in your diet. They're the ones that come from personal care products. You avoid these by becoming a minimalist. You don't need deodorant, okay? I think deodorant is a sign of stupidity, okay? When somebody walks in the room and say, hey, how you doing? They don't sniff your armpits. I'm looking real quick for my estrogen book. I know I got it right over here. It's right over here somewhere. Here we go. By the way, this is the best book on estrogen chemistry. It's called Estrogeneration, and that's the author there, Anthony J. PhD. He's a biochemist who specializes in lipids. This is a great book. It's one of the all-time 25 best health books ever written. It's funny, it's clever, it's smart, it's concise. Everything about it is great. If you decide you want to learn more about estrogen chemistry, this would be the next book to go to, Endocrine Disruption and Human Health by Philippa Darbra. She's a PhD scientist who did a lot of research in estrogen chemistry. She's from England. Anthony J, by the way, has lots of videos on the internet. I think she's got some too, Darbra. Okay, so be a minimalist with your personal care products. Herbicides and pesticides, eat organic only to avoid most of these. Detergents and soaps, be a minimalist with that. You don't need to be rubbing these chemicals on yourself all the time. For example, in the shower, the only thing I don't even use shampoo anymore. You don't need it. Mainly because I'm bald too, but it doesn't make any difference with the rest of my hair, so I don't use it. I haven't used shampoo now for a while. It's over a year, and I wish I had quit the stuff sooner. What else? Dishwasher. If you don't cook with oil, you don't even need dishwasher detergent. For laundry, I just run it hot. I don't even put any laundry detergent on there. Anything that's antimicrobial is also bad for human tissue. Miscellaneous estrogenic chemicals like PFOAs, that's from cooking on Teflon. You don't need Teflon to cook on. Oh, crap, sorry about that. I'm trying to move my little guy right here, if I can move him. Oh, I keep moving the screen rather than my little talk thing. Anyways, okay, we'll talk about some of these individual chemicals. I'll explain to you how it works here in the next slide. Oh, first of all, briefly, what do estrogen chemicals do? They basically increase all the female things. They increase menstruation. They increase breast tissue growth. They keep a little more mineral in the bones in case the baby needs it while she's premenopausal. If the estrogens get too high, that's a sign that a woman is like pregnant. That's why the birth control pill, EE2, is ethinyl estradiol, because in a sense it tells the body it's pregnant, so don't ovulate. And that's what a birth control pill does. But it says store extra weight, gain weight. It's a fat storage hormone because the baby might need that energy. So it makes people fat. It makes the blood a little more prone to clotting. When men have high estrogen, they sometimes get big boobs. So the so-called beer belly is because of estrogens. The hops in beer are estrogenic, and the man boobs or the moobs, that's also due to estrogen. They're called moobs. They're outside the medical words gynecomastia, elevation of increase in size of the male breast. It causes apathy in young men, and some people think that that's partly why there's more women than men in college now. About a little bit over 60% of the college students are female. I think it's also partly because there's discrimination against men. Men are the scapegoated group in modern society, and that's not good. Society's being feminized. That's not good, but it is what it is. Estrogenics also cause increase in size of the male prostate and increase the risk of male prostate cancer. The male prostate is embryologically like the female uterus, so estrogenic chemicals stimulate the uterine lining. They also stimulate growth of the prostate. So if you're a guy, you don't want to end up with a big prostate. You want to avoid these estrogenics. Okay, this is a book we just talked about, Estrogeneration by Anthony J. estrogenic effects principle. This is as put forth by Anthony J, and it's true. If a chemical is estrogenic in one way, it's going to be estrogenic in other ways. There's two main receptors for estrogen hormones. There's estrogen receptor alpha, and that's the main one we think of as being related to the secondary sexual characteristics, especially breast growth and uterine growth, prostate growth. But then there's ER beta, which does a lot of the other things related to estrogen. Okay, and here I mentioned the Philippa Darbra book. The Neil Bernard book is also quite good, Your Body in Balance, especially for people having estrogen-like problems like endometriosis, etc., heavy periods, PMS, all that, postmenopausal hot flashes, all that stuff. If you're interested in sort of the environmental chemistry of estrogen, this is a good book. And it's relevant because there's tons of estrogens in the environment. Because once it goes from all these human cosmetic products, it then gets into the water. And you'll see it's related to a lot more than that. This is a major health issue in the modern world. I'm going to show you how to avoid this stuff really easy, but tons of people die because of this. Okay, the main estrogen in the human body is estradiol. Di means 2, all means alcohol or hydroxy group, so that's called E2. And we talked about the birth control pill being called EE2 because there's an additional substituent on it, ethinyl. Ethinyl estradiol is birth control pill. Estrone. It's the "one" sound at the end, the suffix, because it has a ketone, and it only has one hydroxyl group, so it's called E1. E3 has 3 hydroxyl groups, estriol, so 3 all groups, alcohol groups, hydroxy groups, same thing for our purposes. Like all steroid hormones, estrogens readily diffuse across plasma membranes, and they do not need transport proteins to enter cells. Not good. So one little small estrogen molecule can do a lot of damage. You don't need high concentrations of them. And the scary thing is, the normal blood levels in a woman are 20 to 400 picograms per milliliter. And it'll vary during the menstrual cycle. Okay, men actually have about the same amount as a woman does at her low point, 20 picograms per ml. But why is this important to know? Because think about that, 20 picogram. A person can easily have levels in their blood thousands of times higher than that. So even though you might read, well, such and such is a relatively weak activator of the estrogen receptors. Well, when you have 1,000 times more of it than the body's normal hormones, you'll get abnormal activation of those estrogen receptors. And I think this is a major, major, major big deal. Because, for example, you got a young kid, like a boy, confused about whether or not he's a boy and a girl. The first thing one should do, in my opinion, is find out if he's been exposed to lots of estrogenic chemicals. Fix that problem first and then see what happens, okay? Other things, these estrogenic chemicals can be synergistic, meaning that they're acting together to increase the overall estrogenic effect. And there's tons and tons of these things. BPA is the hard, clear plastic. Phthalates make it even more clear, and they condition the plastic to shape it. These things are ubiquitous, okay? Parabenzoic acids are a great preservative. They're all over the place, parabenzoic acids. Phytoestrogens are the estrogens from plant foods. Atrazine is a herbicide sprayed on corn and grass. GP is glyphosate, that's sprayed on soy, also estrogenic. And these things this is the most common herbicide sprayed in America. They're super common. They get into the water. It's too expensive for municipal water filtration to remove these things. So they get into the tap water. That's why you need to have a carbon water filter at your house. That's one of the reasons. Testosterone is converted in the body, in fat tissue in particular, by the aromatase enzyme into estrogen. So the fatter a person is, the more they're going to convert their testosterone into estrogen. Not good. Let's see, what else is interesting? You talked about EE2 being the birth control pill. I'm going to get to the chemistry here in just a moment. Okay, what else do these estrogenic chemicals do? They increase proliferation of the uterine muscle, the myometrium, and that's where fibroids come from. And fibroids are, can be a big deal. I've had women tell me their entire family, every single woman, sister, mother, aunts, they all had to get hysterectomies before the age of 35. Well, guess what? If you get a hysterectomy before the age of 35, you got increased risk of hypertension, myocardial infarction, cerebrovascular accident, dementia, congestive heart failure. Mayo Clinic did a study on these. Mayo Clinic hysterectomy study of over 2,094 patients. And they found that they were pretty serious. The younger the person got the hysterectomy, the more serious the consequences. And it's kind of obvious if you know anything about hysterectomies and its effect on blood viscosity. When a woman gets a hysterectomy, she stops menstruating. So that means menstruation is a therapeutic phlebotomy every month. It lowers her hematocrit, her red blood cell count in her blood, which means it makes her blood less thick. Her blood becomes more like water, less like, it becomes more like a milkshake, higher hematocrit, more red blood cells, less like water. So it's thicker blood. It's harder for the heart to pump it through the blood vessel, so it has to raise pressure, so it causes hypertension. In addition, when red blood cells first come out of the bone marrow, they're soft. And they have to be soft because a red blood cell is bigger than a capillary. It's about 7 microns in diameter. Capillary is about 5 microns. And therefore, in order to pump these red blood cells through the capillaries when they are more stiff, when they first come out of the marrow, they're more flexible, more deformable. Over time, they become progressively glycated and more stiff. Typical red blood cell lives about 120 days. So what am I saying? Because a woman constantly bleeds every month, she keeps on kicking more young red blood cells out of her bone marrow that are soft and pliable, deformable, flexible, so that lowers her blood pressure. Women have significantly lower blood pressure when they're premenopausal in comparison with men. Hypertension, high blood pressure is the #1 risk factor for atherosclerosis. So you'll almost never hear about a woman having a myocardial infarction or something premenopausal unless she's like, 200 pounds overweight or something. So that's why women live longer. That's why women don't start getting heart attacks until they're postmenopausal. And what I'm saying is that they get this hysterectomy at a young age. Typically, they're oblivious to it. Now, a guy, if he has got a brain in his head, he starts becoming scared of coronary artery disease by the time he's in his late 30s because he starts seeing guys his own age from his high school getting myocardial infarctions and having all these problems. So if he's got a brain in his head, he starts to worry about his cholesterol. Versus a woman, she doesn't see any of the other premenopausal women having any problems. So a lot of women, they're not as careful about their diets. I can tell you, I know a top-notch nurse worked in ICUs, post-surgical cares, and she says to me, "Oh, Dr. Rogers, she's about 48 years old. My total cholesterol is 300. Is that bad?" And she, of all people, should know better. But to her, it was kind of like a joke because none of her premenopausal cohorts had any cardiovascular problems. But when she becomes postmenopausal, problems can happen pretty fast. So it's a good idea to get that under control. Whenever I look at brains, I see a demented brain in a woman. Usually women got a clean looking brain, no strokes on it, between the ages of about, let's say, 45 to 60. I seldom see any lesions on their brain. They come for headaches or whatever the problem, and their brains are usually clean. But if I get a demented female, and I do get a significant number of them, if I get a demented female in that age range, let's say 40 to 45 to 62, first thing I check is the usual suspects. Is she a drug addict? Okay. Is she an alcoholic? Why is this lady demented? And if I don't find an obvious explanation for it, the next thing I check for is, did she have a hysterectomy? And I can tell you, most of the time, when they don't have the obvious other risk factors, the explanation comes from the fact she had a hysterectomy before the age of 35. So then she became hypertensive without being aware of it and has all these hypertension-related strokes in her brain. Okay, so all these other stuff, endometriosis, infertility, morning sickness to pregnancy, all these things are associated with high estrogen levels and these estrogenic chemicals. In Japan before 1970, they didn't even have a word for estrogenic chemicals. Okay, they get more breast cancer, more breast masses that are benign, like fibrocystic disease, for example. Okay, here's just a picture of it showing all the problems in a woman. Morning sickness, postpartum depression, all the stuff from elevated estrogenics, breast cancer. We talked about deodorant in other lectures. You get deodorant on the armpit. You've got shared lymphatics between the breast and the armpit. It used to be that only 30% of breast cancer was upper outer quadrant, but nowadays it's about 60%, and that's because of the deodorants, You're rubbing aluminum, a metalloestrogen, and a parabenzoic acid preservative in your deodorant in your armpit, and those lymphatics are shared between the armpit and the breast, so that's why 60% of breast cancer is now upper outer quadrant. So stop using deodorant, okay? If you're using regular deodorant, that's stupid, okay? I've had millions of conversations with men about women. Never once did a guy say, well, she's kind of cute, but she's got, armpit odor. Never in my whole life have I heard that. What I hear guys tell me all the time? She's fat. I'm just not attracted to her because she's fat. I can't help it. And the man's brain, when a woman's fat, his brain's programmed to think that means pregnancy. And it's like, why risk asking out a girl if she's fat when, you could get beaten up by her boyfriend or father or brother, or she could, claim sexual harassment or something. So why even say anything romantic to her? It's just not worth the risk for nothing. You can't make a baby with her. That's why your primitive brain says that. in a guy. We can't help it. Every time we see a woman, our brain says yes or no. It just does. We don't even think about it, okay? And fat means no. All right. Okay, we talked about all these other things. Fibroid tumors, also called leiomyomas. In children, it'll cause undescended testicles, hypospadia, and also men with high estrogen will get gynecomastia, breast development. In a woman, in a younger one, it'll cause premature thoracic development of the breast, premature menses, premature menarche. Also, women get trapped in this vicious cycle of becoming fat. They get more and more fat, and with their obesity, you know, they can be addicted to junk food from the MSG, from the caffeine. They could be drinking beer. All these things contribute to obesity. But once they're fat, all the extra fat tissue makes more estrogen, and it keeps on making them fatter. Also, being diabetic, they often take medicines that increase insulin, for example, and then it makes them fatter. So they get in this vicious cycle, and they can't break it unless they go low-fat vegan. Okay, now here's the key chemistry to see. Here is cholesterol. Cholesterol is the backbone of estrogen. So it has 4 cyclic rings, the A, B, C, and D rings. Okay, and on cholesterol, it has OL like an alcohol. So there's the alcohol group, OL. Hydroxy group and alcohol group is the same for our purposes. Polar, because this is polarized, there's a charge difference on it. Non-polar, because there's relatively little charge difference amongst the carbon-hydrogen bonds. Okay, now here's estradiol. Di meaning 2 hydroxy groups. Here's one hydroxy group. Here's the other hydroxy group. The unique thing about the estrogen hormones is they've got an aromatic ring, meaning that there's 3 double bonds. The 3 double bonds are highly significant because they actually move around amongst these carbons, and they allow the electrons in what's called a pi orbital to run along all 6 carbons. And the point is they're super stable. They got very high shelf life. This could sit on a shelf for 5 years. So the companies love estrogenic preservatives. They love them. They're perfect. They're never going to go away. They're worth billions of dollars. The hydroxyl group makes them antimicrobial. So if you put them in a cosmetic product, no mold will grow in the cosmetic product. So they want it in there. They got to keep the thing on the shelf. Otherwise, it'll get sent back to the company. They lose money. The aromatic ring, it comes from the fact that aromatic, they used to have an aroma, a pleasant smell. With the benzene. The 6-carbon ring itself, cyclohexane ring, if you will, is called the benzene ring. And so this combination of a benzene ring with a hydroxyl group is called a phenol. And they're great preservatives. They're in just about everything. That's why you got to be a minimalist, avoid this stuff. So when the estrogen molecule gets inside the estrogen receptor in your cell, what happens is it'll form a hydrogen bond with the receptor, the estrogen receptor. So there's estrogen receptor alpha, estrogen receptor beta. And this hydrogen bond linkage right here holds it in the pocket. The estrogen receptor is not very fussy about the rest of the molecule. It just cares about the phenol component, this aromatic ring and the hydroxyl group. And because of that, anything else attached to here, it'll still bind the estrogen receptor. Maybe not as strong, but strong enough to cause estrogenic effects. And that's a big deal. Okay, now here's how it works in the real world. Everybody's heard of BPA, which is in plastics. BPA means bisphenol A. Bis means 2 of a thing when they're separated from each other on a molecule. So there's a hydroxyl group here and a hydroxyl group here. This is a phenol group. This is a phenol group. So there's 2 phenol groups separated in the middle by a couple carbons. And so bis meaning 2 hydroxyl groups, phenols or 2 phenols, bisphenol, 2 phenols. Type A, they just call it. And here's why I'm showing you this. People started to complain because BPA was causing so many problems, and it was in baby bottles, which is ridiculous because, the baby's drinking estrogenic chemicals. I mean, think how bad that is. The kid's drinking soy formula, soy's estrogenic, out of an aluminum can. The aluminum's estrogenic with a BPA lining in the can or putting it in a baby bottle. That's estrogenic. Not good. And it's sweetened with corn syrup, which is sprayed with an estrogenic herbicide, atrazine. Not good. And the soy sprayed, non-GMO soy, probably with glyphosate, estrogenic. Not good. So the poor little baby is drinking this baby formula. How many estrogens was that? 1 for the aluminum, 2 for the soy, 3 for the glyphosate, 4 for the atrazine sprayed on the corn syrup sweetener. Okay, and then the BPA liner on the can with the baby bottle. That's 5 estrogens being given to some poor kid. Feel sorry for the poor kid. Okay, so anyway, so now people say, oh, BPA is bad, BPA is bad, BPA should be banned. Yeah, whoop-de-doo. You know what the company does? It says, okay, we'll take the carbons out of here, we'll put a sulfate in there. So this is BPS. bisphenol sulfate. And they're always going to do that. So the only thing to do is only use glass for the water bottle if you're going to put something into a bottle to drink out of, or the baby. And, try to breastfeed as much as possible. I think women should be getting a lot more than 3 months for a baby. You really want to breastfeed a baby at least 6 months if possible. It's better for the child's brain development. What a baby really needs is in the mama's milk. And also the mama should watch her diet and filter her water with a carbon filter so that she doesn't get more estrogens into her breast milk. People wonder why the population is becoming stupider. That's one of the reasons right there. Okay, this is just more about the details of BPA. If you're curious, bottom line, it's in all these plastics, and it gets into the foods and the drinks, and it has an estrogenic effect. And okay, this is a little bit interesting. When you have increased estrogen in your body, your liver's in your right upper quadrant. So your liver detoxifies the estrogen. It conjugates it by adding a glucuronic acid to the estrogen. That makes it more water soluble. Think of a glucuronic acid as being similar to a glucose molecule with a carboxylic acid attached to it. And so then it excretes it into the bile, which goes into your intestinal tract, and then you defecate it out, and that's how your body gets rid of excess estrogen. But guess what? There's two types of gut flora. The good gut flora comes from eating plant foods. The plant foods have fiber, so I'll use green for a plant here. The green plant food fiber is taken by the good bacteria, and they use that to be healthy. They're symbiotic with us. They make it into short-chain fatty acids like butyrate, and that's used by the gut lining to maintain tight junctions. Everything good comes from plant foods. They want us to live. Our colon's a good apartment for them. And now I'm going to tell you, only problems come from processed food and meat. They're bad all the way. The bacteria associated with meat and processed foods are about the same. And the reason is plant foods have fiber, good. Processed food and meat have no fiber, bad. So processed food and meat, bad. No fiber, bad. What happens then is you get a different type of colon bacteria. And the type of colon bacteria associated with meat and processed food, they have an increased amount of this enzyme, glucuronidase. So glucuronidase means that they cut the conjugation off the estrogen. So when you cleave this bond, here's the estrogen, E for estrogen, bound to a glucuronic acid. You cleave that bond. Now the estrogen is free of the glucuronic acid. It gets reabsorbed in the blood. So a meat-eating woman, processed food-eating woman, she's going to have higher estrogen levels. Higher estrogen levels mean higher risk of breast cancer, higher risk of fibroid tumors of the uterus, and all kinds of other estrogen-related problems. So that's a real important point. Okay, here's another estrogenic chemical in the environment, triclosan. When you have a chloride on there, you can get a chloride leaving group and have a phenol-like effect. And, there's a phenol right there on it. And so this is in a lot of soaps. It's in some toothpaste and detergents. It's on conveyor belts. Basically, if you see triclosan in something, don't use it. And I recommend being minimalist with all this stuff because they're all going to have at least one. I remember I was using what I thought was the safest possible baby shampoo. It was for newborn babies. So they got to put it on a newborn baby and the kid has to survive. Okay, at least it's been tested to that extent. And even this newborn baby shampoo had 2 estrogens in it. You'd be amazed how ubiquitous these chemicals are. I don't use any toothpaste. I just brush my teeth like once a week or twice a week with no toothpaste on there just to remove the biofilms that the bacteria can sort of hide in, like strep viridans. I don't use any toothpaste. There's so many toxic chemicals in toothpaste. But anyways, I wanted to make this point too. Chloride leaving groups can be related to estrogenic chemicals on an aromatic ring. Okay, here again is the phenol. These are nonylphenols. These are very common in detergents. Sort of the classic one here. Let me move my little guy. Okay, is this one. It looks like a sperm. 4-nonylphenol. I said it looks like a sperm. This looks like the tail of the sperm, and this looks like the head of the sperm. And the bottom line, this is super common in your detergents and whatnot. So you want to minimize your exposure. I knew a lady doctor from Korea, and she says, oh, we just boil our laundry, We don't use any detergent. So I don't use any detergent. I haven't used it for many, many years. I'm lazy, and I hate the smell of stuff. The little dryer squares that people put in the dryer, those are estrogenic. Typical person pouring a liquid detergent on their clothes for washing their clothes, I think it's stupid because the container is plastic made out of BPA. The plastic container is conditioned with phthalates, that's 2 estrogens. The soap itself is nonylphenol, that's 3 estrogen. And then if you have those dryer squares to minimize wrinkles in the dryer, that's 4 estrogens on your clothes. It's in contact with your skin all the time. And when it's in contact with your skin, in chemistry, like dissolves like. Your skin is primarily lipid, meaning fat and keratin, for example. when you swim in the water, like you jump into a pool, you jump into the ocean, you don't instantly gain 10 pounds, and that's because your skin keeps the water out. Water is polar. So your skin is designed to keep water out, but it is not designed to keep fat out. Nobody swims in oil, okay? And because of that, when you put oily things on your skin, which is basically all cosmetic products, they're absorbed transdermally. And what I'm saying about your clothes is, you know, a typical person is doing their clothes with laundry detergent, and, you know, there's 3 estrogens right there in the dryer squares, 4 estrogens. They're in contact with your skin all day long. These chemicals are being absorbed in your body. And especially, let's say you're wearing polyester clothing. That means polyester terephthalate, and that's estrogenic, okay? So that's 5 estrogens on a lot of people all day long. No wonder estrogen levels are so high. No wonder the American population is becoming totally feminized, okay? Men are much less macho than they used to be when I was a young guy. So anyways, being aware of this, you can avoid it. Just don't use any detergent or dryer squares on your laundry. Easy to do, okay? With your dishes in the dishwasher, what I do is I just rinse my dish off and put it back on the shelf. I don't need to run it through the washing machine. Whoop-de-doo. Unless you're cooking with oil, I don't think you need that. All right. Also, a lot of non-phenols are banned in other countries, but not in the United States. People in the United States are exposed to tons of estrogenic chemicals, tons of them. And like I said, they're in your drinking water. The BPA is in your drinking water. If you drink tap water, EE2 is. The glyphosates, people are exposed to a significant amount of soy. Many people eat that stuff. Let's see, benzophenones, all the sunscreens got a lot of these estrogenic chemicals in them. They're associated with male infertility. I would stay away from this stuff. Okay, just briefly, what is this parabenzoic term all about? So here's a benzene ring, aromatic ring, same thing. Here's the hydroxyl group on it, so it's a phenol. The benzoic acid is where the name comes from. So here's a carboxylic acid on this. Will be called a benzoic acid. But the point is, if you have something, this is the dominant substituent, something in the adjacent carbon, that will be called the ortho position. I put a little dot in there like the eyes. This is making like a face as a mnemonic to remember this. This is the M position, the meta position relative to this dominant substituent. So I remember M for mustache, and I drew a mustache on here. And then P for power position is the exact opposite on the 6-carbon ring down here. And so that is a cyclohexane, if you will. That's, I say, it protrudes. That's how I remember P for power position. And that's what parabenzoic acid. So parabenzoic acid just means in the power position is where your hydroxyl group is for your phenol. So that's all it means. And there's tons of different types of parabens, just like there's tons of different types of phthalates, and there's multiple different types of bisphenols. And that's why I mean these chemicals are ubiquitous. They will never go away. All you can do is learn how to avoid them. And they also can interfere with thyroid function. A lot of estrogenic chemicals also have a damaging effect on the thyroid. It makes them extra bad. And here's just showing all kinds of weird chemicals. This chemical here, sometimes too, they're not necessarily activating the estrogen receptor. Sometimes they're activating the aromatase enzyme. And if they all they have to do is just activate something that increases the estrogen pathway, and you'll get more estrogenic effects. And so anything with a food dye in it is bad. These food dye names are just like euphemisms a lot of times for these complex petroleum chemicals. So red number 40 sounds kind of harmless. Take a look at the size of this molecule. You know, it's a nasty monster, all right? So again, you want to avoid all these things if you can. And there's a whole set of literature about the toxic effect of these food dyes on the cognitive function of a child, etc. We're not going to get into that today. So this was simply an introduction to estrogen chemistry, and the main thing I wanted you to get out of it was the hydrogen bond formed in the estrogen receptor, and that being the reason why tons of other chemicals will activate the estrogen receptor. I think, you know, evolutionarily, there was no competition for that estrogen receptor in the past. All these estrogenic chemicals are part of the modern world, you know, like the last 100 years. So the estrogen receptor is not prepared to deal with them. It didn't have to be exclusionary in the past, but now it does, and it doesn't know how. It can't change that fast. So tons of things activate that estrogen receptor, cause estrogenic effects, and then cause the side effect consequences that are harmful to people's health. So I hope that was helpful.